Hi everyone, it's great to be here with you to kick off our first healthcare.gov hangout. I'm Julie Bataille, the Communications Director at the Center for Medicare and Medicaid Services here at the Department of Health and Human Services. Millions of Americans are already benefiting from benefits and protections available to them from the Affordable Care Act, including free preventive care and savings on prescription drugs. The new health insurance marketplace is an important part of the healthcare law, and it means that soon there will be a new place for individuals, families, and small businesses to get more affordable health insurance, even if you get sick or lose a job. I hope you'll find this a good discussion today. And if you have questions, we're following them right now on Twitter, so please tweet us using the hashtag HCGovHangout. We know that these issues are especially important to families. Nobody plans to get sick or hurt, but one accident or injury can wipe out a person's savings or leave them with a lot of debt. And they're important to my guest today, the Executive Director of Moms Rising, Kristen Rao-Finkbeiner. Kristen, thank you so much for joining us today.
Thank you so much for having me here today. It is a delight to be here. With more than 1 million members, Moms Rising is mobilizing grassroots actions to help ensure healthcare coverage for all. And we are working hard to make sure that everybody has a chance to get access to healthcare coverage. Moving forward, would you like to share some thoughts?
Well, I was just going to say, Kristen, I'm so excited that you were the guest today for our first healthcare.gov hangout. Mom myself, I know how important these issues are for our families and how much of a difference we make in the healthcare decisions that take place around kitchen tables. And these conversations, I think, can be especially meaningful as people need to understand what's ahead and what new options will be available to them.
Thank you. At Moms Rising, we are making sure that there are provisions available to women, to children, and to families. And this is such an important conversation. To pick up what Julie just said, we take on the most critical issues facing parents across the nation by mobilizing massive grassroots actions to bring forward the voices and real-world experiences of women and mothers straight to our nation's leaders, to amplify women's voices and issues in the national media, to accelerate grassroots impact on Capitol Hill and at state capitals across the country, and to hold corporations accountable for the fair treatment of women and mothers. We know that moms are often the decision makers in the family when it comes to health care, and we recently heard from one Moms Rising member who has a very important story to share because she is looking for coverage herself. We heard from Angela. She's from Arizona, and she wrote, "I am a mother of 4 who has been uninsured for the past 2 years. After my divorce, my children remained insured, but I lost my health coverage and couldn't find any affordable options for myself. Thankfully," she wrote, quote, "I am in good health and rarely see the doctor. I prefer," she said, "to treat myself rather than seek out-of-pocket medical care that may take years for me to pay off." However, it's not far from her mind that if, God forbid, she's in an accident or one day she finds a lump, her young family could be financially ruined forever.
You know, it's stories like that that really bring meaning to the work that we are doing here at HHS and really bring to life the new benefits and protections that are going to be available to people. And I think the more we can do to make concrete those stories and who can benefit, the better we will do in terms of raising awareness and helping people understand their options. Starting October 1st, the new health insurance marketplace will give anyone who is uninsured or who buys their own coverage a whole new way to shop for insurance. Coverage begins on January 1st, 2014. And it's the only place where you can get lower costs on monthly premiums and out-of-pocket expenses, or see if you qualify for Medicaid or the Children's Health Insurance Program. To give you a better idea of what the health insurance marketplace is all about, here's a short video that covers some of the key features of it.
You can do all the things you do with more peace of mind, less worry, and more financial security when you know you've got health insurance. And now everyone will be able to find health insurance at the Health Insurance Marketplace. It's an online shopping site where you shop for health insurance that you can do all the things you do with more peace of mind, less worry, and more financial security when you know you've got health insurance. And now everyone will be able to find health insurance at the Health Insurance Marketplace. It's an online shopping site where you shop for health insurance that fits you, with low cost and even zero premium plans for those whose income qualifies. If you or your family are uninsured or just looking for better coverage, you can see your options all in one place with one application. It's a place to compare a wide range of quality health insurance plans, to review them all side by side, and choose the one that's right for you. You'll find the information clear and easy to understand. You'll explore the marketplace at your own pace. You can compare prices and benefits, see an explanation of what a premium is, and what a plan will cost you every month before you make a choice. And every plan will cover you with comprehensive benefits, from your visits to the doctor or the hospital, to your prescriptions, to screenings for cancer and other conditions. And no plan can turn you away even if you already have an illness or condition. The Health Insurance Marketplace, part of the healthcare law, opening October 1st. You can learn more right here, right now, and be ready for the new world of health insurance shopping.
So, Kristen, as we tell people about the new health insurance marketplace, I'd really love to hear your perspective and why you and Moms Rising think something like this is so important.
Let's face it, worrying about our children never ends. We're still moms even when our kids grow up. And one thing that's important to note is that moms worry about our 3-year-olds. We worry about our 23-year-olds, and we even worry about our 53-year-olds. So moms have an important role to play when it comes to healthcare coverage. We're the only ones who can say things like, if you're going to do that 360 on your motorcycle, you might want to insure more than that bike. In fact, this morning, while discussing healthcare over coffee, a motorcyclist said, you need to clarify that you need to insure your entire body, not just your head, right? This is important. So moms have an important thing to say here. And of course, ensuring that young adults have health coverage is important for more than just motorcyclists. It's important for everyone's wellness. It's also important for everyone's financial security. And financial security for moms and their families comes from having health care. That's why we are grateful, we're excited, and we're waiting for the full implementation of the Affordable Care Act. And we are excited that already young adults up to age 26 can now stay on their parents' health insurance. At Moms Rising, we hear from people every day who are thankful for these provisions. Members like Tracy Munoz, who shared this quote. She shared, quote, my young adult son is taking a year off from school. He has to pay back school loans from his first year of school, and he's working full-time with a small business. He simply can't afford health insurance on his own, and we simply can't afford to pay it for him. So adding him onto my policy until he's 26 years old due to the passage of health reform was an insurance security blanket that all of us needed at a time when I have not had a pay increase in the past 2 years. He is fortunate enough to be relatively healthy, but my husband and I need to have that burden of him being uninsured and possibly having an accident or getting sick off of our shoulders.
Thanks, Kristen. You know, we do hear stories like that all the time, and that's why I am so excited for what's to come and for how many more people can benefit from these new opportunities. Already, we've seen more than 3 million young people now have coverage on their parents' health insurance plans, and soon, if they're not covered on their parents' plans, they will have new options to get coverage through the health insurance marketplace. So now's the time to get ready. And we've got some new customer service channels available to help consumers begin doing that. Healthcare.gov is the online home of the health insurance marketplace. For Spanish speakers, Cuidado de Salud is available as well. Right now, these websites have educational information, videos, and personalized checklists to answer your questions about the marketplace. We've got live web chat available 24/7, and we want to hear from you. We know how many of you are active on social media channels, so you'll find easy ways to share information with your friends and family, and you can sign up for emails and text updates to hear from us over time. And no matter if you access our site on a smartphone, a tablet, a laptop, we're going to be able to display content appropriately in a way that will make sense to you. Over the summer, we'll continue to add new features and information to our site and across our channels, much of it in response to feedback we hear directly from consumers. And come October 1st, you'll be able to fill out a single application to find out if you qualify for lower costs on monthly health insurance premiums or out-of-pocket costs, and then you can choose health plans that are available in your area. We also just opened a toll-free phone hotline. Consumers can now call 1-800-318-2596 to speak with a trained customer service representative, 24 hours a day, 7 days a week. Representatives are available in English and Spanish. We have a TTY line, and there's a language line to help consumers in over 150 languages. We know consumers may choose to access information in a variety of ways, so there'll be help in person for those who want that option too. Just today, in fact, HHS announced funding for community health centers to provide help for people who want to enroll in the marketplace and who may want to do it at in-person locations. There are more than 1,200 health centers across the country delivering care in over 9,000 communities. This is just one of several ways you can find in-person assistance in your local community. We'll have all those resources and information available for you on our website by October 1st. We want to make sure everyone is ready for October because we know there's a real link between health coverage and good health, just like the stories Kristen shared with us. And because we know that the lack of health insurance can mean real insecurity for so many working families. Better than anything I could say, I'd like to share with you another story, a short video of a young woman we met from Philadelphia who's looking for new health insurance options right now. Here's Jamie's story.
My name is Jamie Fontaine, and I'm 27 years old. My friends who have worked service jobs and I all have this theory that you should have to work a service job for at least 2 years so that you know how to act in public. I've been working at the coffee shop for the last 4.5 years. I've never made more than 20 grand in a year. I don't really have a plan. That's not a great thing to have to admit to anybody, but that's just not how my life has worked out since I graduated college. Every time I get sick, I get, if it can't be fixed with like Advil, NyQuil, and a good night's sleep, I don't really have a solution for it. I don't know what I would do if I got very ill or very injured. Honestly, I haven't been to a doctor since my 11th grade physical. Between all of the obligations I already have, like utilities and rent and student loan payments, within my budget, there's no way I can afford healthcare. If something bad happened to me, if I were in an accident or if I developed some kind of serious illness, there's no possible way I could afford it. I don't have that kind of savings. My savings would be gone in an instant. I have no plan. I can't afford a plan. Life with health insurance would offer comfort and stability and safety.
Jamie's story is one of many that you may know about. Please share your stories with us today. Post on our Facebook page, visit our social media channels, and tell us why health insurance is important to you and your family. These stories make new benefits real to people, and they illustrate the promise of the Affordable Care Act. With that in mind, I'd like to ask Kristen to say a few words before we begin taking questions.
Thank you so much, Julie. I know that all of us at Moms Rising want to see the full promise of the Affordable Care Act become a reality, and for that to happen, we all have to step up to the plate. We need to talk with one another. We need to get the word out, and we need to discuss this with the young people in our lives, because when it comes to making big decisions like buying health insurance, it's important to have someone to talk to, and that someone is typically a mom. And now we'd be happy to open this up to take your questions online.
So we're going to take questions right now from the Twitter feed that we've had going live all morning. We're so grateful to all of you for joining us today for our first ever conversation. Our first question is from a lifelong educator in Georgia, and he's asking us, if our state, Georgia, doesn't have an exchange, can we use the federal government exchange? Well, yes, absolutely. In fact, you can use healthcare.gov to apply for coverage, compare your options, and enroll. In fact, I'd encourage you to go there today to just start getting some educational information, sign up for our listserv so we can keep you updated as we make progress towards the beginning of open enrollment. Our next question is Kristen from Seattle, not this Kristen from Seattle, but Kristen asks us, how will the new health insurance exchanges work with COBRA offered through current or former employees? You know, that's actually a great question, and much of what we're seeing across our customer service channels so far is individual questions and people's experiences who are looking for information that's relevant to them. In terms of COBRA and folks who have COBRA, you've really got two primary options. There is COBRA, and then you can certainly seek out a marketplace plan. Remember, coverage begins January 1st, so check out your options beginning in the fall. See which is better for you, the existing COBRA coverage, or if you'd rather switch to a marketplace plan, and then take advantage of doing that. Make sure to contact your COBRA officials for particular information and coverage terminations and questions, but please know that both are options for you. Our next question actually comes from a blogger. A young student named Crystal asked us, what about full health insurance for full-time students attending college or university, those folks that are 21 or older? How am I impacted? Well, Kristen, you may want to add something here from what you've heard for Moms Rising, but I would say for anyone who is under the age of 26, please remember you are eligible to still stay on your parents' plan. If that's not an option for you and your particular family, please know the marketplace would be a great alternative for you. And beginning October 1st, you'll be able to go there to complete an application and check out the options that may be right for you.
And I think one of the things that's exciting and important about this is that there is one-stop shopping. You can go to healthcare.gov. You can find out what your opportunities are, regardless of whether your state does or doesn't have a marketplace.
And, you know, I'm actually really glad you said that. One of the things that is so important to us, and much of the feedback that we have heard from people as we're developing our customer service channels, is to make sure information is written in a way that they can understand, make sure that we simplify this as much as possible. So please know we are really taking that to heart, and all the work that we are doing is really to design a consumer-friendly process and be able to provide people information in a way that they will understand, in a way that they can quickly and easily navigate the entire process. So then we go to Elena from Chicago. She is asking us, what is the minimum income for an uninsured working person to qualify for a government subsidy to buy health insurance through the new exchange? Elena, thank you so much for asking that question. What I would tell you is that the vast majority of people who are uninsured who seek coverage through the marketplace will be able to take advantage of lower costs on their monthly premiums. What that means on average is that if an individual makes up to about $45,000, or for a family of four who make up to $94,000, they will be able to see savings off of either their monthly premium or their out-of-pocket cost. And I think this is the question. We've got time for one more question, and this comes to us from Lambert, who is worried about the fact that the only computer access I have is very slow, and it's at the library. Will I be able to apply for Obamacare? Absolutely, Lambert. We are making sure to take care of you. You should know that, first of all, our new website loads really quick, so even if you've got a slow connection, hopefully we're helping you out. But we're also mindful of the fact that people may not have internet access in their home. We've just announced a partnership with libraries so that across the country, people will be able to use them for actual enrollment destinations and access to computers in the fall. But also know that we've made sure that channels are available for however you may choose to access us. So call our toll-free hotline. If you're not interested in applying online, you can go to one of those in-person assisters. In fact, a community health center, or we'll have navigators and other forms of local help available. And remember, you can always download and complete the application that you'll find online and mail it into us. The options are available for you. You can choose how to access us, apply and enroll, and we certainly encourage you to do that. In closing, we don't have time for any more questions for Twitter. We certainly appreciate all those we've gotten. Please know that we will continue to use our social channels over the course of this afternoon and in the coming days and months to be responsive to your questions, to continue this conversation. We're really looking forward to that. Thank you so much, Kristen, for joining our first Hangout as a mom. It was really important for me to have you join us for this. And we're really excited to be really engaging in this conversation as we move forward. Thanks to all of you for joining us today. We look forward to hearing from you, understanding your stories, and we'll talk to you soon. Thanks so much.